Assalamu alaikum guys, my name is Mohamad I studying in the Tishk International University and I'm a dental student stage 2. This video is supervised by Dr. Reba Samir and I want to talk about the head and neck anatomy of this statue. And look at here, I want to talk about these structures. Here, if you look at here, first thing we see is muscle. This is red structures, all of them is muscle. First of all, we want to talk about the facial muscles, like a buccinator, like a orbicularis oris, like a temporalis muscle in here, this temporalis muscle. This is important for evaluating the mandible and chewing. And we have a platysma muscle in here. But before everything, we can see some nerves in here, some nerves. For example, some facial nerves and trigeminal nerves. Trigeminal nerves is divided three parts. One of them for mandible, another one for maxillary, another one for eye, for head, for eye, like that. And we have auriculotemporalis muscle in here. Auriculotemporalis muscle and nerve in here. And then we want to start with the blood vessels. These blue and red ones. This is artery, and we can say this is artery and veins. We have superficial temporal artery. This superficial temporal artery supplies the blood to the scalp and face. And facial artery. We have facial artery. Facial artery provided blood vessels to the lips and nose and cheeks. Another one is external carotid artery. Look at here. This red one. This is I think number 22. This is external carotid artery. This external carotid artery, the main artery supplying the blood to the face and head. Another thing we want to talk about it is parotoid glands. These parotoid glands that creating the saliva. One of the largest salivary gland that are responsible for producing saliva is called parotoid gland. Parotoid gland, okay? We have another salivary gland in here. Look at here. This is submandibular gland, and we have sublingual. Sublingual, it's just below the lingual in here, but doesn't mention it in this statue. And we have sublingual. Okay. Another thing, it's a duct. It's a salivary duct. Okay, in here. Look at here. And if we want to talk about the head, the below parts, we can see the cerebellum. This is cerebellum, and this is cerebellum. This is lower part. And then we're gonna go through the nasal cavity. The nasal cavity, we have cerebrum plate, and we have three conchi in here. One of them is superior nasal conchi, another one middle conchi, another one inferior conchi, and we have three mucus. This is three mucus, okay? And this is Eustachian tube that we studied before in the grade 12. If we talk about the pharynx, in here we see the pharynx. Pharynx is divided in three types. One of them is nasopharynx, another one is the oropharynx, another one laryngopharynx, okay? And if we see something like redness in here, like a tissue, it's a tonsil. This is a pharyngeal tonsil, okay? And this is a lingual tonsil, below the lingual. And this is, if you talk about those two things, this is a sinuses. This is a frontal sinus, this is a sphenoid sinus, okay? And this is the hard palate. This is bony structure, but this is the soft palate, and this is a uvula, okay? And this is the tongue, and the tongue have many muscles. Some muscles of the tongue I want to talk about. We have a extrinsic muscle, we have a intrinsic muscle, for intrinsic, for extrinsic, like that. And then we wanna through here. This is a mandible. This is a mandible, and this is a hyoid bone. And this in here we can see the thyroid gland we call Adam's apple, okay? And if I want to talk about the vertebral column and spinal cord, we can see the vertebral column is in here, and this is a spinal cord. This is a spinal cord, okay? And then what remains, this is the teeth and end of the video.